Hi, I am so pleased to be here today for another edition of the 55 Ways to a Better Me. My name is Fallon Magdich-Ritchey. I am a nurse practitioner. I work here with Dr. Scarmack in the Rural Healthcare Pediatric Office. We are located here in Logan, across from CVS. Our office has been in Logan for over 20 years. Dr. Scarmack has been with us for 15 years, and I have been with the practice now for 7. We strive to provide well and acute ill care to the pediatric population of Logan and the surrounding counties. In continuance of the 55 Ways to a Better Me, I have been asked to discuss a topic on childhood health. I chose physical activity for children. Parents serve as role models for their children, and any positive changes that parents make will set good examples for children to learn from. As I review recommendations on physical health and activity for children, I hope parents can find ways to incorporate change into their own daily routine and not just for their children. I know as a parent there is so much to worry about when raising a child. Are they getting enough sleep? Are they eating enough fruits and vegetables? Are they developing normally? The topic today of physical health and activity, I believe, lies at the heart of all these other questions. I will explain how they're all related, but first let's look at some of the recent statistics on child health. In doing some research for today, I came across a report from Nationwide Children's Hospital. This comes from Columbus, Ohio. The most recent report showed that 30% of kids are defined as being obese. So I think it's important we understand what it means to be obese. In children, we compare their heights and their weights together to determine where their body habitus lies, and we call that their BMI. So we don't just look at their weight, we don't just look at their height, because children come in all sizes. But when we look at a BMI, when it's greater than 85%, that defines a child as being obese. And what that means is if you took 100 kids, that child would have a body mass index greater than 85 of them. 1 in 7 kids nationwide is defined as being obese. So we can see that we're actually doing worse than our national average. 1/2 of children in Ohio report that they do not exercise enough, and 1/3 watch 3 or more hours of TV a day. So thinking about being in school and then coming home and watching 3 hours of TV a day makes it hard to find time for dinner, things at home, and getting exercise in. In that report, 84% also reported that they eat less than the recommended amounts of fruits and vegetables. So why such a focus on children's numbers? I think it's important to kind of think about the future for our children. Children are gaining excess weight at a younger age faster than ever before. And in children, it's easier to change these bad habits now than wait till adulthood. Studies show children's preferences for food and activity levels are set by the time the child is 2 to 3. So this means that we have to start young, and from day one, we need to set good examples for our children and encourage them to make healthy decisions. So let's talk a little bit about physical activity. Why is it important to be physically active? There are many health benefits to exercise. First, I think this is really important because it improves sleep, and a lot of us have trouble with our children sleeping, and I get patients every day that report problems with falling asleep and maintaining sleep. And one of the most natural and safe things you can do is to increase the kids' activity level to help with their sleep. Activity helps with improved focus and grades. Children with learning disorders, hyperactivity, all do better by increasing their physical activity. It also improves mood and reduces stress. So right now, this past year has been a really stressful time for our kids. And with the changes in their schooling and the changes in their home life, I think that's one of the best ways we can really help them feel more self-confidence, lower their anxiety and their depression, is just to get out and play with them, be active with them, encourage them to get involved into activities that keep them active every day, looking for sports now that we're allowed to go back to sports. Physical activity lowers the risk of health conditions and also reduces the likelihood of obesity. So the health conditions, I think, is important because we don't always think about what it's going to mean for our children when they grow up. But if we can do things now that prevents them from getting diabetes and early heart disease, then we're just going to give them so many more years of their life and healthier years where they feel happier and better about themselves. In the past year of COVID, I've seen firsthand this increase on that stress and anxiety for children. And I just think that now more than ever, it's time that we start to focus on them getting active. So how much activity should a child get each day? There's a little chart here that'll break it down for you a little bit better. So I'm just going to briefly kind of go through what the main recommendations are. Activity level and types of activity depends on the age of the child. School children need at least 60 minutes of activity a day. So makes it about an hour of active activity. And preschool and toddlers need 3 hours of activity, but 1 hour should be vigorous activity. Those kids are on the move all the time, and they need to be up and playing, moving around the house. They shouldn't be sitting down in front of a TV. But the 1 hour vigorous activity is more like running outside, jumping, riding their tricycle, kicking the ball, playing tag. So when we start with toddlers and preschools, we're going to talk about these activities like riding a bike, going to the park, up and down the swings and the slides. Those are ways to get in that vigorous activity. These activities are also important to help develop motor skills. Motor skills are what we get from playing ball and tag and kicking the ball and climbing up ladders, just helping with their coordination and their strength, building up their strength. This also helps with their cardiovascular health. School-age children, it's a little bit of a different situation. These kids have to sit more. They have to be at school. They have to be watching the teacher and the computer screen. So we expect more time sitting. So we need to focus on when they're physically active, that they're doing it in a way to get the most benefit from it. And it can be challenging to find physical activity that a child enjoys and feels successful doing. Sports is not an option for every child, but you need to talk to your children and listen to them and find things that they are interested in. They might like biking or hiking. They can go just play outside or go for a walk. Martial arts is something we have locally that a lot of kids like when they're not necessarily involved on a sports team. There's dance and gymnastics or even just swimming at the pool. School-age children also have very busy schedules. So dedicating a time daily for activity is important. If it's part of a daily routine, it will be easier to maintain physical activity levels. For example, after school each day, set an hour to play outside before dinner and homework. Not only will it help with their focus on their homework, but it also will help with their appetite for dinner. Teens can have even busier schedules than school-age children. So we want to make sure they find an activity that they're interested in so they stay committed to it. Sports, yoga, skateboarding, running, any of those activities are great that they can do by themselves or with others. You just want to create a plan with them to engage in an activity daily. Make sure you praise your child for staying active and then join them from time to time. This will reinforce the behavior, and it's also a great time to bond and catch up with their busy lives. Well, with all these outdoor recommendations, I do feel like we should talk about safety a little bit. So when playing outdoors, remember we need to wear bug spray to prevent bug bites in the warmer weather. Also, we want to check for ticks. We've had a lot of ticks this past month. They're also the really small ticks, so you got to check closely. Look for hot spots on kids, behind their ears, behind the knees, and the scalp and the groin. If you do find a tick that's attached, make sure you remove it. If it's been attached longer than 3 days or has any signs or symptoms, you do want to discuss with your healthcare provider. Always wear a helmet when you're on any kind of wheeled apparatus. So bicycles, skateboards, roller skates, scooters. It's the easiest way to prevent concussions, skull injuries, traumatic injuries to the brain. It's also really important when kids are outside that we stay hydrated. So remind your kids to drink water. Remember, adolescents need 8 glasses of water a day. Children can be a little less, but we need to make sure they're drinking water and not sugary beverages and not sports drinks. Those are just needless sugar, calories, and salt. Just focus on water with them. Make sure you use sunscreen every 2 hours, SPF 30 or higher. And you also want to teach your kids about swimmer safety. Make sure they know safe times to swim, never to swim alone, never to dive into water of unknown depth. If they don't know how to swim, there's a lot of options. You can look at any of our local city pools or the YMCA for swimming classes. One important topic we need to cover also is screen time. Screen time directly affects our activity level. And after a year of homeschooling and remote learning, our children are exposed to more screen time than ever. Screen time includes any activity with a screen. So that also means your tablets, your smartphones, any of our gaming consoles, computers, and televisions. The American Academy of Pediatrics recommends children under 18 months be exposed to no screen time, which I know is really hard because lots of small children enjoy all these fun TV shows they have, but it's really not in their best interest. They need to be exploring their world. They need to be developing their gross motor skills and their fine motor skills by playing with blocks and coloring. So those TVs really offer very little benefit to them. Now, after 18 months to 2 years, if you're going to show them something on a screen, just make sure it's a high quality educational app and for less than an hour a day. The recommendations for children ages 2 to 5 is to limit it to an hour a day or less, and also really focus that what they are watching for that hour is really educational and aiming to teach them something. Over 6, the media recommendations are a little more challenging, especially in our world today, because so much of the kids' learning is based on media exposure. So the limits should be set at home. The media doesn't interfere with activity and sleep needs. Children shouldn't have their phones in their beds at night. They need to focus on getting a full night's sleep. They shouldn't be at the dinner table. You need to still set times at home where they need to be off their phone. I still recommend to my patients that they be on their phones, screens, or tablets less than 2 hours a day at home. Some of the most recent studies say that most kids average about 7 hours a day of screen time, so way above what we would be recommending. And that's made a big difference in these obesity rates. These kids are happy to sit and do nothing but look at these social media apps for hours on end. And although they're engaging that way, they're not engaging their body, and therefore we're just going to end up with a lot of health problems as these kids get older. So how to set reasonable limits on screen time? One thing you do is set up screen-free zones in your house. The dinner table, meal times. Like I said, I really believe kids shouldn't have it in their beds at night. Those are great. No phones, no TVs. Also, make sure that they're off these screens 30 minutes prior to bedtime, because all that exposure can affect how they fall asleep. Make sure you charge devices overnight in kitchens or living rooms. That way kids aren't tempted to get back on them when they aren't falling asleep right away. And talk to all the family members in your family. You guys create a media plan. Kids watch what parents do. If we're on our phones all night long, they're going to be on their phones all night. So set guidelines and rules that are achievable that everyone can follow. This will help increase activity and decrease screen time. This is a win-win for all. So, anybody feeling motivated to go outside and play yet? There's so much opportunity in our county for outdoor activities. Consider hiking at a state park or checking out one of our local parks in town. There's a lot of them that have just got facelifts and look wonderful. So some of the great people in town have been working on. There's basketball courts and tennis courts. There's several in town that are open for the public. And we have the city pool. These are all ways to get active. Not to mention just ride downtown, take a walk around town with your kids, stop at the yogurt shop if you want to go down for an activity. If you're looking for something to do at home and maybe not feeling 100% safe about going out, Help Me Grow is sponsoring Doodlebugs this year. This is going to be a virtual event. This is on the first Tuesday of every month at 11. It'll be on Facebook Live. So you can stop by at Help Me Grow or at the Hocking County Library, pick up a kit to take home, and they will go through that kit online with the children, and then they will read a story. The library has its summer reading programs. If you guys have never been a part of these programs, they're great for kids and they're interactive. So it'll get your kid out to the parks. This summer reading program is every Wednesday at 10 a.m. It'll be at Cacklemackle Park, and it offers a free lunch with it. You do have to register though, but you can enroll at any time. Story time in the park is another event that they hold. This one's on Thursday at 10 a.m. at Cacklemackle Park. Same, they'll be provided for lunch. Story time is best for pre-K through 3rd grade, but all are welcome. Project Safe is also hosting a summer feeding program. So this is held on Fridays from 11 to 12:30 at the middle school. Free lunch will be provided along with books and chances for kids to earn tickets for prizes. There is a free family movie night with DVDs to rent and popcorn to take home. Weekend packs and family food boxes are also available through this program. So in the last slide here, there are ways to contact these programs in town if you're looking for ways to get involved or need contact information on signing up for these programs. So please reach out, get your kids out, enjoy the summer, enjoy the weather, and really start helping them learn to make some better changes with their activity level so that they can be healthier as they grow up. Thank you.